We have none other than Kentucky Senator Rand Paul.
Great to see you.
No comment about your feet. I am not going to talk. I refuse to talk about feet.
Oh,
So
come on.
it's-
You have on socks. You can do it.
Yes, he wears socks.
Okay.
So, Senator, read a Politico article that Donald Trump was watching you on, I think, this show, talking about the Affordable Care Act, and actually called you up. And are you all talking about a way to replace Obamacare?
Absolutely. I think we should have a replacement bill same day, same time, simultaneously, exactly the same day.
Right.
And we've been complaining about Obamacare for 6 years. Certainly, we can have a replacement bill on the same day. I'm putting one together. It's in legislative language, and we'll release it to everybody Tuesday or Wednesday of next week.
So I have a lot of Republican friends who actually are on Obamacare. Will they have the same kind of coverage? Because there are a lot of, if you just say, hey, I'll tell you what we're going to do. We're going to give you health savings accounts.
Right.
They'll go, what?
Yeah.
I want coverage.
I know, but when you look at what happened under Obamacare, more people did get insurance, but the vast majority of them got Medicaid. I'm assuming your friends are not on Medicaid, right? So the thing is we want more people who are working class people who can't afford insurance to get insurance. So the main thing you have to do is the opposite of what Obamacare did. You need to make insurance less expensive.
How do you do that?
Well, you can't mandate what's in it. If you tell someone that insurance has to include 10 different items like Obamacare did, then it will be more expensive. We should let insurance be sold to what the consumer wants. That's what we do in every other marketplace.
But Donald Trump has already said that you've got the pre-existing conditions part has to be in there.
Right.
Kids shouldn't be bumped off until they're
There are ways to get there, and you can get there when you have leverage and enough people buying things. If you're an insurance pool of one person, you can't do that, and you can't say, oh, you can wait till you get sick to buy insurance. In fact, there's one very important thing that everybody needs to know. You cannot insure against something that is already known. So if we already know that you're dead, we can't sell you life insurance. If we already know that you're sick, we can't sell you insurance against being sick. Insurance is against something that's unknown. Now, you can take care of people, and you're going to have to take care of people, but I've been one saying that the really sick people that already have pre-existing conditions, it's dumb to buy them any form of insurance, a risk pool, any of that. Putting a bunch of sick people in a pool and buying them insurance makes no sense at all.
So what do you do for people with
You have to take
pre-existing
care of them.
conditions?
If they're poor, you take care of them through a government program. That's what we've done through Medicaid and everything's like that.
Well, what if
that,
you're middle class, you've got diabetes, you're 46 years old, you've lost your job.
Right.
Are you going to tell that person to go on Medicaid?
No, what you want to do for most people is you want to have enough people able to join together to have leverage, to have lower prices regardless of a pre-existing condition. So if I work for General Motors and my wife is already sick and I get a job tomorrow, they're still going to give me insurance because I'm part of a big group of people and they're able to sell insurance that way. What my replacement plan does is that if you're mom and pop and you're a pest control business, it's terrible that you have to buy insurance by yourself. That should never happen. And government created that situation back in World War II. I would let mom and pop pest control join together with 100,000 other people and buy their insurance as part of an association. And that leverage would lower prices, but that leverage also allows them to buy insurance that can't be canceled and protects them against getting sick and having their rates go up.
The arcane language of health insurance is Greek to most Americans who hear you talking about it and other senators talking about it. The 20 million people or so who got health insurance coverage under the Affordable Care Act just here, they're going to take my coverage away. I'm enjoying coverage that I didn't have before and now it's going away. What do you say to them?
It's not going to happen. Basically, we're going to give them a replacement. We're going to expand the number. First thing to know about Obamacare is millions of people don't have insurance now. So Obamacare wasn't perfect, and that millions of people who did get coverage have gotten Medicaid. The ideal type of coverage isn't Medicaid. Most people don't want to be on Medicaid unless they have to be, unless they are unable to get a job. So the other part of this argument is you want a robust economy that creates millions of jobs. We're growing at 1% right now. If we were growing at 4%, that's 3 million more jobs, 3 million more people that don't have to be on government assistance.
All right, Senator Rand Paul, thank you so much.